Thank you very much, the AeHIN friends, especially Buchai, Fasila, and other friends. So it's my honor to have a sharing in tonight to share about some eHealth situation in Hong Kong, also about Singapore. I do not know too much about Singapore, but I will try to share about the Singapore, the country profile of the GOE, and hope that there will be some nice between the Singapore and Hong Kong about some similarities and difference between Singapore and Hong Kong. As you know, Hong Kong in the past 20 years, many people will compare about Singapore and Hong Kong. So because Hong Kong and Singapore in the size of the land and also the population is quite similar. So many people will compare Hong Kong and Singapore. I hope that this sharing session is not really a comparison between the eHealth about the eHealth in Singapore and Hong Kong, but it's just a reference about how Hong Kong developed its eHealth and what's the situation about Singapore in 2015 and the current situation of the Singapore and Hong Kong. So I would like to share a brief review about the global observatory for eHealth for Hong Kong and Singapore. This session is just a review based on the infrastructure of the GOE by the WHO. And the information of this slide is from the Singapore country profile in 2015. And also my company's some study on Hong Kong eHealth situation. Because you know the Hong Kong one country system is not a single country. So there's a low country profile in the WHO GOE. Okay, so wait a moment, I'd like to, okay. I would like to have some context, some background about Singapore and Hong Kong. For the population, as I mentioned, that Hong Kong have 7.5 million population, little bit more than Singapore, about 500 population in 2015. And for the GNI per capita, we are quite close, about 65,000 and 76,000. For the nurse density, Hong Kong is much higher. We have a 6.15 and Singapore has 5.76. I don't know Singapore in this year or last year the situation, but I think that the number of the nurse and midwife density is quite similar, about 5 and 6. And for the hospital bed, I think Hong Kong have quite much. We have a 55 per 10,000 population, and Singapore have 31 per 10,000 population. But in fact, in Hong Kong, for the public hospital, we still do not have enough beds, hospital bed in most public hospitals. Sometimes we have over 100% or 120% the occupation of the bed. Okay, and for the life expectancy at birth, if some persons may know that Hong Kong, the people have the longest life around the world. We have a 84.9 the age. I think the number one in the world about the life expectancy at birth. Okay, for the total health expenditure, we have 6.2, quite high per the GDP, and Singapore has a 4.6 percent against the GDP. And for the ICT development, I think that Hong Kong is quite mature about the ICT development. We are ranked number 6 for the world, and Singapore's 15 in 2015. And because as some people know that Hong Kong 20 years or 30 years ago, we have already started to develop the hospital systems, especially the for the hospital authority, the CMS, and we have about 20 to 30 years for the development of the health system, especially as also as other systems in the different industry. So for the ICT, we are adopted quite for a long time about the IT development. And for the mobile cellular subscription, we have about 300. It's quite high for the population, and Singapore is 150. Actually, for Hong Kong people, actually on average, we have more than one mobile phone, maybe 2 or 3, the SIM card. is for different use for the Hong Kong people. For the internet use, we have over 90%, and Singapore in 2015, they have 74% for the population of the internet users. Okay, so next slide. Okay, the first point about the GOE for the Singapore and Hong Kong for the eHealth Foundation. Actually, the first column from the left is Hong Kong we found in this year, and the second column is Singapore. I think that we are quite similar about each items. For example, we both have the UHC, and we both have the eHealth policy, and also the HIS, and also Telehealth policy, and or strategy. Because for Hong Kong, we have some guidelines for the Telehealth. Okay. For the funding source, our system is quite close because we based on the public funding, the money from the government, and the private or commercial. We do not accept some private funding because all the money for the public health is from the government, and so do not accept the non-public funding. And for PPP, I think that for the funding source, we do not accept the PPP. So, Singapore and Hong Kong quite similar is the funding source. And multi-language, I think that Hong Kong and Singapore similar. We both have the Chinese and English, the language, and also internet size. We have in Hong Kong we have English and Chinese. I think same as Singapore. And eHealth capacity quite similar. We both provide the training to the students and also the professionals. But for Hong Kong, the training for the professionals is not provided by the government. Most of the professional training is provided by the associations of Hong Kong. In Hong Kong, we have the medical councils and some associations for different subjects. So the associations will provide different trainings to the professionals. Okay, for this session is about some policy for the for this one about the law. In Hong Kong, we do not define some medical jurisdiction or liability or reimbursement of eHealth service, similar to Singapore. And for the patient safety and quality of care based on the data quality, data transmission standards, it's hard to say for Hong Kong because in Hong Kong we have a new built system named eHealth record sharing system. For the patient safety and quality of care based on the data quality, we will rely on this system, but it's not for the whole Hong Kong, just for the public health and also some clinic and hospital monitoring. I don't know if Singapore, their response in 2015, they address for the patient safety for what guidelines. It's not cannot be compared. So for the privacy, we have a privacy law for a long time in Hong Kong. So, but the privacy law is quite generic and not specified for the privacy of the health data for each person. But we have the eHealth law for the health data inside the system. So it's hard to say yes or no for the privacy of the personality identification data for each individual. So for the privacy of the health data, we have the law, both laws, and for the data sharing between the health professionals, we have the sharing system for several years, I think similar to Singapore. And for the sharing about the data between different services through the use of EHR, we have the system. We also have the sharing between the research entities and also the electronic access to their own data. For Hong Kong, this year, we launched the patient app, the mobile app, both in Android and iOS. So each person, each individual, they can access to read their health record through the app. And for the individual, we allow they to demand their own data to be corrected, but not electronic. They can only access to, I think, send an email or apply online, and then to correct. This means that they cannot correct their health data immediately through the mobile app. They need to apply through some process to correct their data. And for the demand deletion, I think we cannot request to delete our data in Hong Kong. And the second one about allow the individual to specify which health data from their eHealth record can be shared. Actually, a few years ago, we have a discussion about allow the individual to specify which data to share. And in legally, we have this feature to allow them, but in the system, we do not see that this feature is provided in the system, either in the health record system or in the individual app. So I would say low for these features. And if you can see the global years response in 2015, the percentage for this item is quite low, just about 28% for this item. For the governance, the C4 registration and vital statistics, I think yes or no, because for Hong Kong, we have a system for the C4 registration. But for the vital data, we do not have such a system to govern the vital data of each individual. So the last item for the national identification management system, I think yes or no, because Hong Kong, we have a tertiary right, Hong Kong ID system for each individual. But for the health citizens, we do not have individual system for that. Yeah. So you can see this table for Hong Kong and Singapore. Quite some items is a yes for both sides, but some items Hong Kong has some, for example, have some features, but Singapore has low these features. Okay, we move to the telehealth. Last night, we heard some speakers like Poon Chai, Vasila, and Elvin share about the telehealth. For Hong Kong, I would say intermediate because last year and this year we all face the pandemic situation, COVID-19, and all the health service about some programs will transform to telehealth. So for the telehealth in Hong Kong, we have different sectors. We have some individual telehealth programs in the hospital and in the clusters. But for the whole centralized by the government, we do not have. But for individual hospital, we do have some telehealth programs. So for Singapore, I think the situation, as I know, is quite similar. They have quite intermediate programs for different sectors. But for the centralized telehealth programs, they have some guidelines. And so they have some centralized programs, but not specific for these items. So they will say quite intermediate for those programs. And also for the last item about the remote patient monitoring, I think both sides will have local remote patient monitoring, especially for some wards, some hospitals, some organizations. But for the national or territory-wide, we do not have a quite single remote patient monitoring system for both Hong Kong and Singapore. Okay, for this slide about the EHR, Hong Kong and Singapore, for the national eHealth record system, we both have these systems. And for Hong Kong, we have the law to governing the use of those systems. And for Singapore, they respond low, but I'm not sure in these few years, they already, as I know, they already have some law by 2022. So I think they will have the law for use of the EHR this year or next year, or maybe already in practice already. So for Hong Kong, I would say yes for all the health facilities and also insurance systems. You would say yes, and for Singapore, both yes. And I will specifically address the automatic vaccination alert system. In Hong Kong, we have built the automatic vaccination alert. It means that when we do the vaccination this year, the system will automatically remind us to do the next dose, and also they will remind us the details about the time, the date, and also the venue. So I think for the Singapore, they respond low 6 years ago, but these 2 years, I believe they have a similar system to alert or remind the citizen to do the vaccination. I think in other countries like Philippines or Malaysia or even Thailand, I think all they have similar systems. So maybe we can share later in this tonight. Okay, for the Hong Kong, the ICT assisted functions like the building, the supply chain, and human resource. I think Singapore and Hong Kong both have similar systems. Okay, next one. This session about the use of the e-learning. And as I say that for Hong Kong this year and last year, because we all faced the pandemic, the COVID-19. So all the training, the programs, either in the for the students or the professionals, they turn to the e-learning channel. But I will say that for the e-learning, even for the public health, for the nursing and my wife, and also the pharmacy, the e-learning means that very basic. It means that they use some tools like Zoom, Microsoft Teams, these tools to do the video conferencing e-learning. From my personal understanding, for the e-learning, it's quite many features and many functions and many complicated instead of only simple in the Zoom, the e-learning. So in this slide, I will say that Hong Kong has some basic e-learning in practice for those students and professionals. But for the very professional e-learning programs, some universities or some organizations, they will provide some e-learning platform for the students, but not all for all the students and professionals. Okay, so for this eHealth, for the toll-free emergency, actually, both Singapore and Hong Kong, we have the toll-free emergency. But for Hong Kong, when we call the ambulance, it's free of charge, of course. And then for Hong Kong, we go to the AE room, and the AE room, the hospital, will charge us 200 Hong Kong dollars. It means about $20 US dollars, I think. So actually, it's not totally free, but if you have low money, they will still handle you free of charge. So I would say, yes, we have the toll-free emergency. And also we have the health care centers through the 999, and also appointment reminders through the apps, and mobile telehealth. We have some apps. I will say later about the Hong Kong, what's the app, the features. And also we have some treatment adherence intermediate. I think all our those features similar to Singapore as they respond in 2015. So for the assessing and providing health information, we will use the mobile app to provide the health information to the community, and also to let them to access those information. The app also have the patient records, and for the eLearning or mobile learning, it's quite basic. We have some shortcuts, and let the citizens through the app to access some educational information, and also to link to the website to enroll or register for some webinars for the eLearning. And for the decision support systems for Hong Kong, we have local systems for each departments of the hospitals. I think for Singapore, similar. They have local systems for the decision making, but not the national. And for Singapore, I think they have, of course, similar to Hong Kong, they have eLearning patient records, and also community mobilization for the health information. So the last sectors for the collecting the health information, Hong Kong and Singapore quite similar. And we have some intermediate patient monitoring. It means that for the individual hospital, we have some patient monitoring system, but not for all the hospital and for all the patients. For the health service, similar. We have like individual surveys, online or offline, but not all the national. For the disease surveillance, we have the disease surveillance system. So for the both the clinics, we have the Hong Kong have the disease surveillance system applied to the private clinic, so they can report some disease, communicable disease to the government through the platform. I think Singapore is quite similar. They have a similar system to survey with the surveillance of the disease. Okay, for this line, for the social media, both Singapore and Hong Kong, we have the policy, the use of the social media by the government. It means that inside the government department, we have some guidelines to monitor or govern the use of social media, either Facebook and also other Twitter, what the news and what the channel to make the news to the public. Also, we have some policy to make specific reference in the use of the health domain. For example, in Hong Kong, the government will govern the different departments to apply the health domain under the gov.hk or some other domains. We have some guidelines. I think Singapore is quite similar. They under the gov.sg or other domain guidelines. For the healthcare organization use of social media, most Hong Kong, either the government or the private sector, we will use the social media to promote the health message. It's a health promotion campaigns. I think Singapore is similar, and they will for the help to manage the patient appointments. We do not use the social media platform to manage the patient appointments. We will use their own systems. For example, for Hong Kong, for the government or the hospital authority, they will have their own platform, their own app to manage the patient appointments. Even in the private sector, for some private clinics or hospitals, they will have their own tools to let the patient to manage the patient appointments instead of using the social media. In fact, I think for other countries, if they use the social media to manage the patient appointments, it's quite dangerous and not secure because of the security issue. I think there are many open source and free or platforms or software to allow the patient, the organization to help the patient to manage the patient appointments instead of use some social media like Google or some other Microsoft social platform to manage the patient appointments. So for the feedback, yes, of course, because we both have the social media platform, the accounts, so they will allow the patient to have some feedback on the website or for the social media to have some response for the service. And of course, for the general health announcement, they will have the features for the health announcements and also the emergency announcements. So for the use of the social media in Hong Kong, all yes, and Singapore, all yes. I think it's about already half an hour, so I will go much faster. Sorry about the long time for the serving of these sessions. So for the big data, for Hong Kong, we have low regulation to govern the big data. Either Singapore, I think low regulation for that. Okay, the last two slides. I would like to share some highlights about Hong Kong and Singapore, some programs and some initiatives. For Hong Kong, as I mentioned, we have the eHealth record sharing system since 2016, and also the legal framework for that. We have the eHealth record app for the patient and hospital authority Go, HA Go. We have the data collaboration lab. It's like a sandbox, like other countries. We can let the universities to join the lab to use their data, either sample data or the real data, to have some AI development and some application development. We have the smart hospital. We have the ethical guidelines on practice of the telemedicine. Like Singapore, they also have some national telemedicine guidelines 6 years ago. They have a regulatory sandbox 3 years ago. They have some guidelines for the telehealth products 2 years ago. And also, they are working on some licensing scheme for the telehealth under the law by next year. I think they will do already enact the law and launch the scheme. Okay. So last thing, I will have some address about the looking forward in the post-pandemic. 5 points. The first one is about the PPP funding model and ROI model. For the eHealth, because for Hong Kong, we order eHealth from the public funding. But for the eHealth, this sector's development, I think that we need to have some challenge about the PPP, public-private partnership funding model, and how to adjust the ROI, the return on the investment for those private sector the investment. The second point, I think, is about the definition of the medical liability. The third one is about, can we allow the individual to delete their health data and specific patient to share, because it's quite challenging about the whole public health. And the fourth one is about the value harmonized about the eHealth stakeholders. In Hong Kong, we have about 10 years about how the eHealth stakeholders, especially from the private sector, to harmonize their value in the market, among others. The last one is about the governance for the use of the health big data and AI. As my observation, for many countries, including Hong Kong, this place, most government use a top-down governance. But I cannot see any mature model about the bottom-up governance. For example, can the citizens, the organizations, to work together with the government to build a PPP governance for the use of the health big data and the development of the AI. So this slide is just I bring out some my personal observation of the pain points for the eHealth development in Hong Kong, maybe also in East Asia, I don't know. So I would like to look forward to some sharing with each others. This is the end of my sharing. Thank you very much.
Yes, thank you for that presentation, Sir Kube. So we're now open for questions. I have also enabled the microphones of the attendees if you would like to ask. We have a question here from Miss Irina. Miss Irina, would you like me to read this or would you like to ask for the microphone?
Okay. Can you hear me?
Yes.
Yeah, I can hear you. Yeah.
Thank you so much. It's a very impressive presentation. I was working in Singapore in 2013, and I've seen from the inside how the healthcare system's built. And as an enterprise architect, I have an enterprise architecture question. How mature is enterprise architecture in Hong Kong? Is it used to drive the change? Is it used to develop any new integrations or evolve any existing systems? Because it's obvious you have quite impressive results in integrations and in the implementation of various systems, including the mobile apps and communication to patients. Like, how was it achieved? Did it help you to have? Does it exist in Hong Kong? Any enterprise architecture practice?
Thank you very much. Yuna, I think you're right that you are the expert of the enterprise architecture. In Hong Kong, my personal are involved in the government, the projects, and so some project architecture for over 10 years. So for Hong Kong, we have similar architecture, like Bun Chai mentioned, or Alvin mentioned, or you mentioned. We have at the top, we have some steering committee, and then we have some project owner. And also we adopt the Prince2. I know that you are very familiar about Prince2.
Yes.
We use Prince2 in Hong Kong. We need every project manager, we need a Prince2 certificate for the project. And also we have the steering committee. We have the project owner in the steering committee. We have several domain experts in the steering committee. So we have the project team, including the vendor, the PM, and internal PM. So the vendors PM, we need them to have a Prince2 cert, and also in the client side, we have the PM2 internal PM. The client side PM, sometimes from the users, not IT, sometimes from the IT department, the government IT department. I means that we have the IT department of the government. They will appoint the system manager on site to the project to help the implementation of the project. So this is the overall of the architecture of this one. So we have the SAND, the Prince2 methodology, SAND, and then to have some development term, and then UAT, and then roll out similar phase.
So you have all the development phases, right? So you have different. So it doesn't like start changes from production. It
We
includes
yeah.
significant planning.
We use the Prince 2 SAD. Sometimes some process we use a waterfall this methodology, but most of our development, the enterprise architecture, we use a Prince 2. There's from design S&D. We follow the S&D report and then to implement the systems development.
Thank you. And the second part of my question, for the information exchange, is there any interoperability standards used in Hong Kong? The international ones such as HL7, V2,
Yes.
or 5, or it's proprietary?
We use HL7, and also we are the member of Sonoma City. As a Bunchai, very familiar about that. We are quite long to join the Sonoma City, but the Sonoma City we use behind. We use the system behind. We use the Sonoma City some terminology behind for some analysis and for
research.
behind the code. Yes, and HL7 we use the HL7 free version 3, but not Fire. I think Fire we will use soon, but some people in Hong Kong not familiar about Fire. So in Hong Kong this year and next year, we are also planning some training about the Fire HL7.
Fantastic. Thank you so much.
Yes.
Right. Thank you, Miss Irina and Sir Klube. We have another question from Dr. Bunchai. Dr. Bunchai, would you like to ask this?
Yes. Thank you, Klube, for very wonderful comparison. And I actually Hong Kong and Singapore is kind of the role model for many countries in Asia in terms of the development of the digital health. To my knowledge, is that Hong Kong has a very impressive health information exchange for more than 2 decades through the hospital authorities. But it seems like you expanded to the people, to the clinics, and in the last kind of the 5 years, I learned that the Hong Kong are trying to kind of they call the ramp up the connection between the private clinic and the clinic to the hospitals. My question is around that project. How well it implemented this project? Is this right now can private clinic or the primary care clinic can exchange data with the hospital in Hong Kong?
Thank you, Bunchai. You're quite updated about our Hong Kong situation. Yes, we can, technically, we can totally exchange, allow the private clinic to exchange the data to the hospital. And as you know, I want to share some figures about the Hong Kong situation. In Hong Kong, we have 13 hospital, private hospital, and then 42 public hospitals. So in Hong Kong total, we have about 55 or 57 hospitals in Hong Kong. And for the private sector in Hong Kong, most likely our private sector, about 3,700 private clinic groups will take care about 90% of the primary care of Hong Kong. And those primary care, the clinics, the government, they provide a free modules and software to allow the private clinic to connect their health data to the hospital. And also, what's mean to connect? They will allow the private clinic to upload the patient's data, health data, to the hospital, and the hospital also can share the data to the clinic. And it means that the eHealth service system, record service system, is a central pool. The data all stored in the central pool, and the government will give the tools to the private clinic to upload and access the data from the hospital. So yes, Hong Kong now, all the clinic, if they want to join the program, they can access the data to share the data to the hospital. But for your information, that although there are 3,700 private clinic groups, but only about 2,000 will join the program. It means that still 1,500 will not join the program yet. So our challenge is that many doctors and clinics, they will not want to share the patient's clinic to the hospital or to the government. This is our challenge in Hong Kong.
Okay, thank you. And I found out that
Yes.
you talking about the personal health record that the patient can request their health data from to the maybe to the website or to the app, but they have to ask first, and then they will send back, not immediately get that data. The model is similar to Taiwan. My Health Bank, which is the Taiwan National Health Insurance Administration provide those back to the people. Is that the same model in Hong Kong, that the insurance hold the central data repository, and also organize those information and send back to the people?
Different models. Dr. Bun Chai, Hong Kong and Taiwan on this point is different model. For Taiwan, they have the central insurance scheme to hold the data or manage the data. But for Hong Kong, it's very different, because in Hong Kong, our government quite do not want the insurance company to hold the data. So they hold the eHealth record. They will not allow the insurance company to access those data. So when the citizen, they want to delete or to amend their data, they need to apply or send the application to the government or to the clinic group to access the data or delete the data, instead of they contact the insurance company. It's quite different for this point.
Okay.
Yeah. So, but Hong Kong is now working on the government want to convince the community to make the insurance scheme, but it's also not compulsory. So our citizen can join the scheme or not.
I think if they don't any question, then I think we have another 15 minutes. So Dr. Fazila, would you like to proceed to the talking with Dr. Direct from WHO headquarters about the new favors of assessment of the eHealth in ASEAN Digital Health Working Group?
Yes, can you hear me?
Yes, please.
Yes, in fact, I think Dr. Eric Kayak is also online, and Dr. Derek is also online. Looking at the 2015 global 2015 survey, we all know that it may not be it really needs to be updated, or it may not be relevant. Some of it may not be relevant today. So I'm not sure what is the plan that WHO has for the new survey. Is it going to be totally a new survey? And ASEAN, our ASEAN eHealth group is eager to do the new survey for us to do our benchmark. So maybe Derek can give us some highlight on this.
All right. First of all, I want to thank the Kube, and I hope I pronounced your name very well. Thank you so much, Dr. Kube, for your insightful presentation and for your analysis, from 2015 to 2021, and really putting some language, some voice over. This is exactly the kind of data analysis or presentations that the survey was intended to provide. So I just want to thank you for doing that. The dashboards that, of course, have been used on the WHO websites. We have quite a number of dashboards that were produced in 2015, together with a global analytic report. And what we just heard today is something that should be commended for the data to be discussed, because the data itself can only be transformed into action if discussions are presented on top of the data, so that key actions can actually be conducted. So I wanted to appreciate what ASEAN is actually doing, this committee, in terms of giving chance for the data to be discussed. My apologies, I didn't attend the first meetings. As soon as I was alerted for this meeting, I promptly registered to participate. And so I'll be looking forward to listening to the videos for other sessions. So let me begin by introducing myself. So I'm Derek Munene. I'm the head of capacity building and collaboration. So really working with the 3 layers of the organization, from the headquarters, regions, and countries, and the UN agencies and other networks such as this particular one. Indeed, we have had discussions with the ASEAN States Secretariat, who had requested for using the eHealth Global eHealth Observatory templates and tools to revamp and update the data. And so that discussion is ongoing. We have taken advantage to introduce our strategy and governance team, who is working on what is termed as a dynamic digital health maturity model. That discussion is ongoing. We'll be having a follow-up meeting sometime next week to get an update. The idea of the dynamic maturity model is to really create indicators that exist, including the indicators from the GOE 25 to 2015 survey. So those basically will be consumed within the dynamic digital health maturity model. There are other indicators that will be provided that speak to the global strategy. The key issues with the dynamic maturity model is to really get different data sources. So the GOE data source will be inherited in that platform, plus specific indicators that speak to the key actions in the global survey. As you know, in the global strategy on digital health. As you know, the global strategy on digital health has 4 action points, 4 objectives, and member states have provided actions for the short term, medium term, and long term. So there are specific indicators that will be included that align with the global strategy to complement the indicators from the GOE 2015. And so with the ASEAN states, what we're discussing is rolling it out within the 10 member states, and then eventually scale it up to other regions. We hope to co-create this particular component, and the contribution from the experts from AeHIN will be extremely critical in the formulation of that particular system. It will be dashboard based, so each country will have a dashboard. So what you see as static PDF documents on our websites on the GOE 2015 portal, that will be translated into dynamic dashboards that each country is going to have. And we're quite dynamic because we anticipate the data to be refreshed from time to time, depending on when the data is available. And so that's the dynamic nature of the dashboards. With the global survey on eHealth, we were collecting the data every 5 years or so. And so with the dynamic maturity model, we want to ensure that incrementally, countries are able to update the country situation in a dynamic fashion. So I have a follow-up meeting next week, and hopefully some of the findings or actions will be brought back to the AeHIN Secretariat. So those are the comments I wanted to make. Once again, to thank the AeHIN Secretariat for this particular platform. We'll encourage other regions to have a similar mechanism, because the biggest challenge in digital health is that the data is not discussed. We collect data, publish it, but countries have no platform to discuss what was collected, what it means, and what actions should be taken. So those are the comments, and thank you so much for giving me the floor.
Thank you, Derek. We also have Dr. Eric Tayak online today. Dr. Eric is the chair for the ASEAN eHealth Working Group. Dr. Eric, you have anything to say?
Hello, Fazila. Good evening, everyone. Thank you, Derek, for giving your insights to this meeting. Exactly, that's the reason why we collaborated with AeHIN, so that when we have our meeting in June, the technical working group on eHealth, of which I chair, there will be a better understanding where the 2015 survey and older versions are actually coming from. Like, for example, for the 2013 version, it was focused on women and children's health. And for the 2015 version, it's universal health care. And now we are anticipating the dynamic maturity level. And we understood, Derek, that it will be available soon, just in time, so that when we convene our TWG meeting, we will have a better understanding and make decisions whether or not we're going to adapt it, for example, as soon as we understand what this dynamic maturity level. I'm sorry, Derek, but we will only understand why it's a dynamic maturity level if these are actually presented to us. And as of our last meeting with WHO, they are not available yet. And it will take until the end of the month, and that's next week. So that we'll just wait, and hopefully we'll able to have a better understanding of what the previous surveys and what you have, and if a survey is actually required. And I think it will be, because the context is changing. Thank you, Fazila.
Bunchai, I was also wondering if AeHIN can offer to Derek that we get to see maybe the draft first. No, maybe we can give some feedback and for them before they really finalize the questionnaires.
Okay.
I don't know. This is just a suggestion.
Okay, just to give Dr. Direk a bit context. I think we met in the DTAX also, but it seemed like in the last the whole weeks we have countries to present kind of the review, the situation of the digital of eHealth, to inform both the new the new working group in ASEAN, so that they will up to date of what they are going to kind of the help develop the digital health in this region, which is very fruitful the last the whole weeks. The first day we Dr. Eric Kayak reviewing the situation using the framework of the GOE in 2015 of the Philippines. The second day is Laos and Thailand. The third day is Indonesia, and Malaysia, and the yesterday is Indonesia. Today is Hong Kong and Singapore. So that is the context. We learn several frameworks, and I also inform the group that okay, right now the Digital Health and Innovation Department also kind of introducing a new framework, the new framework that called the dynamic sustainable maturation model. So that if I think Dr. Fazila have mentioned that if you think that the community in this region can be helpful to kind of help you review these frameworks, then we already aware the WHO ITU digital strategy toolkit, which is a different framework from the GOE. And we imagine that the new framework are coming. Mark Randy has informed us that the new framework is kind of the update, or it kind of the improvement of the framework to kind of the respond to the new development. But we haven't seen that. So like Dr. Fazila said, you can use our platform to request kind of the review or feedback to this framework. That would help not only WHO headquarters, but also prepare the countries in the region to more adopting to the new framework. Otherwise, we will suffer from survey after survey after survey, and we don't do anything, just do the survey for WHO. And then we don't use the data, like you said. We don't use the data because we keep doing survey. Over to you, Alvin or Direk, would you like to, or others?
Is there anyone else who would like to say something? Others on the call tonight?
Well, Fasila, this is Dr. Eric again. We have learned a lot in this week about how each member state in the region actually looks at these surveys, and we hope that it's not limited to the people attending these meetings every night, and that the discussions will continue to our countries and involving other people, so that if and when the WHO dynamic maturity level comes out, the discussions will continue, and we can bring forth on the table exactly what is needed in the region. Over, Fazila.
Yes, definitely, Dr. Eric. We will, of course, definitely open up for more, not only those who are involved for these 5 days. I think it has been quite a small group and quite consistent, whoever been attending. Bunchai, to you, Bunchai.
I would like to ask the kind of all the participants. This is a good opportunity that Dr. Eric is also very active on the capacity building, which is we already discussed along 5 days that we should do the digital health capacity building in this region, and also the collaboration between several groups. And this is very honored that Dr. Derek are coming and inform us. So I would like you, all of you, have used this opportunity to kind of the comment, raise the question, or also discussion with the WHO new department, the Digital Health and Innovation, which is very active now. Professor Teng, Joey, or any comments or suggestions?
Yeah. Good evening, Bunchai. Can you hear me?
Yes, clear.
Okay. Regarding the digital maturity model, I think the creation of that model was cited in the Global Digital Health Strategy. And remember, it was presented also, not the indicators yet in our DH tag. And just like you, I'm also waiting for that because we wanted to see how it's aligned with the AeHIN initiatives also. So if this is based on the Global Digital Health Strategy, I hope that after that, it will have to be continued and aligned as well from the very first creation of the maturity model. Over, Dr. Bunchai.
Okay, thank you. Direct, would like you to respond or comments on this?
Yeah. Thanks a lot, Dr. Buchai. This is the exact kind of collaboration that we are looking for as an organization. Networks orchestrate, guide, they bring the energy. The points that Dr. Eric Tayag have mentioned are right on target. And the points that have been mentioned by other speakers are including your own comments and the comments that came just now from Dr. Jovita. I mean, all these are right on target. The advantage we have is that we have two members of the Digital Health Technical Advisory Group in this particular forum. And so this adds value and also brings your voice to the table within the Digital Health Advisory Group. So I'll take these messages back to the DH tag and also to the unit that is working on this particular topic. Otherwise, the comments that have been made are right on target. They're moving us forward than moving us backwards. So we take the point, especially what Dr. Eric Tag has mentioned. This has to be demonstrated, and input from AeHIN and other networks is critical so that we all together can succeed. That's the spirit of cooperation that the department is looking to have. Thank you so much for this opportunity once again.
Dr. Alvin, any comments?
Thank you very much, everyone. This has been a long week, and I'm thankful to Dr. Eric Tayag for giving us the opportunity to be of assistance to the ASEAN. Thank you, Derek, for joining us tonight. Dr. Bunchay, Dr. Fazila, Jai, and all the other AeHIN members. There's a long road ahead of us, and I think as long as we agree to come together, debate, agree, and disagree, I think we will solve this. We just need to help each other and be friends. So with that, am I having the final word, or my chair, my boss will have the final word? I always want to have my boss to have the final word.
No. You should have the final word.
So, on behalf of Dr. Eric Tayag, the chair of the ASEAN eHealth Technical Working Group, and my chair, Dr. Bunchay, and my other AeHIN members, and to Derek, thank you very much for attending the whole week. Please join us when we get to hear more about the dynamic digital health maturity model, and let's support the ASEAN eHealthcare Technical Working Group. Thank you very much, and good night, everyone.
Bye.
Thank you, Evan.
Bye. Good
you.
night.
Good everyone. Good night.
Eric, thank you.
Thank you so much. Bye-bye.
Thank you, Kube. It's excellent.
Thank you. Thank you. Thank you.
Yeah, Clubby.
Thank you,
Thanks,
Priscilla.
Clubby. Thanks.
Thank you,
Bye
Evan.
bye. Good night.
Bye bye. Bye bye.
Bye-bye.